The TSCAN EMG LINK explained. TSCAN 2D, relative force percentages. TSCAN 3D, relative force percentages, shown in 3 dimensions. The graphical interface, very important to keep that up. Quadrant view, separating anterior from posterior, anterior green-red, posterior orange-blue. Immediate complete anterior guidance development. Canine to canine, front circuit, front teeth. Premolar back circuit, back teeth. ICAGD is used to accomplish disclusion time reduction therapy. ICAGD is an occlusal adjustment procedure used on patients with stable and adapted joints. The TSCAN studies relative force per unit time, force on the y-axis, time on the x-axis. First force contact indicated by A. All teeth forcefully coming together indicated by B. Excursion begins indicated by the C line. Posterior is no longer engaged indicated by the D line. Time from A to B, occlusion time, OT. The amount of time the patient clenches together, B to C. Disclusion time, the amount of time it takes for posteriors to disengage and anteriors to engage, C to D. The timing is coincident between the TSCAN and the EMG. Notice the A line. The simultaneity, the B line. These 2 instruments are synced in 3,000 of a second increments in turbo mode. The C line and the D line. Always use turbo mode when performing DTR. Concentrating now on the EMG side of the link. Typically the temporalis and the masseter muscle pairs are studied. Red, in this case, temporalis, green, masseter. The bio-EMG comes in 4-channel and 8-channel units. Depending on which unit you have, determines how many muscle groups you may study. Typically, masseter and temporalis are all that are studied. An example of a right excursion. The center of force icon, the kite, shows graphically in a given instant as to where the average forces are in the arch, provided that the operator properly places the TSCAN sensor between the 2 central incisors. Notice the center of force icon not moving between the B and the C line. At the C line, the patient makes the excursion to the right. The red represents the percentage of force touching the anterior teeth in the excursion, the blue, the working, posterior. Notice the blue working, persistent on the graphical interface. This is hyperfunctioning the muscles of mastication. Thus, this patient's disclusion time is long due to the posterior working and balancing contacts, slowing things up. Notice the hyperactive muscles on the right upper of the EMG graph. TAR, MMR, and MML are very spastic. After treating the right excursion, notice the center force icon. Things are slightly left. In MIP, that will be treated when we work the left excursion. In the meantime, pay attention. In the graphical interface, notice the red line is moving up towards the top of the Y or force axis very quickly. The blue is no longer there holding it up due to no more working interferences in the posterior. Thus, the disclusion time is greatly reduced. The patient hits initially on 9, 10, and 14. Clenching between the B and C line. Notice on the right side on the EMG, the upper right quadrant. Notice how TAL after C is very flat. But right now it's very hyper. Right disclusion time begins at this point. Notice the C. At the C, the TAL, the contralateral opposite temporalis shuts down. Below 8 microvolts would be ideal. In this instance, things are not quite 8 microvolts. They're bouncing around 10 to 14 microvolts. Since this is a right excursion, TAR should be active and working, but not quite this hard. The working interferences and the balancing on number 14, 15 region are slowing things down. Thus, the disclusion time to the right is long. After treating the right excursion, notice that the patient still hits heavily on the left side initially. During the clench, look off to the right in the EMG data. Notice the muscles aren't as hyperactive during the clench as they were pre-DTR. The patient is getting ready to go off into the right excursion at the C line. Notice TAL shutting down rapidly at just past the C line, way below 8 microvolts. This is a good sign. Look how short the exclusion time is as well. Once again, using this right excursion as an example. Light blue representing right posterior contact, red representing right anterior contact. The goal is to get on the anteriors and off of the posteriors quickly. Light blue is represented on the graphical interface. Look at the yellow arrow pointing to the right on the graphical interface. Notice as we circle the working interferences on the 3D. These working interferences are primarily what are hyperfunctioning the muscles. After completing the ICAGD procedure on this right side, the operator would proceed to accomplish ICAGD on the left side, thereby completing the DTR therapy for the patient.